Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient. Been dealing with cancer since late 2020, early 2021. Doing very, very well. So happy for every single day. So happy to open my eyes, and I'm so blessed and so thankful that you could join us here. And I'd appreciate it if you would subscribe to the channel, make a comment in the comment section of the video, and click the notification bell for further notifications. And yeah, that'll help the channel grow because that's what it's all about is sharing this information that I think people really are hungry for. I am doing so well. I mean, there's so many things going on that I'm going to be sharing some big information. I'm not exactly sure when, but I will share it as soon as I could do that. But there's a lot of really, really exciting things going on. And I am so excited about my guest today. His name is Gary Brausen from Minnesota. And so I'd like to bring Gary on. We could have talked for several hours before we realized, hey, we're going to shoot a video. So I'd like to bring Gary on at this time. Gary, please introduce yourself. Tell us a little bit about who you are.
It's a pleasure to be here, Mark. As Mark said, my name is Gary Brausen, and I am a stage 3B lung cancer survivor of 12 years. And I currently, as Mark mentioned, I'm a resident of, of Minneapolis, Minnesota, actually Bloomington, Minnesota. I currently work for a lung cancer foundation, a Breath of Hope Lung Foundation, and I am their manager of patient services and community outreach. It's somewhat miraculous how I ended up in this position. I was on the board of directors of this amazing organization for 9 years, and I came off the board in December of 2022, and then I lost my job as an engineering director in March of this year and went to look for jobs, and they happen to have this position here with a Breath of Hope Lung Foundation. And so here I am. I'm taking care of our patients and managing our community outreach.
I couldn't think of a better person to do that. I mean, that is absolutely fantastic. So, Gary, let's start into your personal story. How did you find out about that you had cancer, and what were the symptoms leading up to your diagnosis, and how did your diagnosis affect you?
So I'm going to take you back to 2010, and it was late in the year, it was fall, and I first noticed a tickle in my throat, and which developed into a cough, and it was kind of a normal cough, and then it continued to worsen with time. And now at the time, I was um, I was playing hockey 3 mornings a week competitively. I was coaching my son's hockey team, and so I was very active. I have two boys. They were 10 and 13 at the time. I was coaching my younger son's hockey team at the time, and I noticed this tickle in my throat, and it just continued to worsen with time into an intense cough that I had never had before. And so that was really the first symptom, Mark, was this really intensive cough like I'd never experienced before. But where things really got dicey and when I really thought that something serious was wrong, I started losing weight without even trying. Now, we all like to lose weight, right? Not under these circumstances, no. And that at that point, I kind of knew something was amiss.
Okay, so then next, what happened? Did you go in to get checked, or you waited, or what was the situation there?
Okay, so I was really busy at the time. I was working as an engineering director with Seagate Technology, high-tech company. And what do we do when we get busy? We put things aside, and sometimes it's our health, and it's not something you should ever do, but I did. Finally, as the symptoms worsened, I said, I gotta go check this. I gotta get this checked out, because I ended up quitting playing hockey. I couldn't play hockey anymore because I was coughing so bad. I stepped down as my son's hockey coach, because I couldn't run the practices anymore. I couldn't lead the games, and I started deferring travel at work. I would tell clients, big companies, I couldn't come down and visit them because I had to delay that travel. So I was finding myself compromising my life. So I thought, I got to take action on this finally. So I went to a minute clinic, and it's you step in at you I think it's probably a physician's assistant that you see, and she diagnosed me with bronchitis, gave me an antibiotic, and of course the antibiotic did not work. And so I let time pass a little bit more, and then around Christmas time I went in and saw my primary care physician, and she checked me out, and she said, "Oh, you just have a virus." And so, just this will pass. It's very similar to what I have. I've been coughing for weeks. It's very similar to what I have. You'll be fine. So I went away. Then I went back again because I was not getting any better. Went back to my primary. So this is the third trip to my primary care physician. And I said, things are getting worse. And again, she said, this is just a virus that's being passed around. Um, it's what I have. I'm still coughing myself. And as I went to leave, I was going to open the door of the examination room, and a voice in my head, and I know where this voice came from. This voice said, get a chest x-ray and get it right now. So I turned
Wow.
to her and I said, I want a chest x-ray, and I want it right now. So we had it, and this began the diagnostics to figure out what was wrong with me. So the chest x-ray indicated a cloudy substance in my left lung. And so my primary care physician came back and said, you have pneumonia, and we're going to treat you with the most aggressive antibiotic that will knock out the pneumonia. Well, after a week of being on the pneumonia, it was a 10-day course. Nothing. I continued to get worse. So I went back one more time. This is the fourth trip, and she said, let's do a CT scan. And the CT scan is much more. You can see with much greater detail what's going on, and that indicated some very strange behavior in my left lung that they didn't fully understand.
Wow. My goodness. So then how long after that did they finally diagnose your cancer?
So I went in. I went to see a pulmonologist, and he was reading the CT scan, and he looked at me and he said, if I didn't see you sitting here, I would have sworn that these lungs were from an 80-year-old man, which
Wow.
is quite shocking to an individual that was playing hockey earlier in that year. And he says, I recommend that we do a bronchoscopy, which is where they go in through your down your trachea, and they take lung tissue. And so a bronchoscopy was ordered, and I went in and had that done. And the tissue was tested, oddly enough, by my neighbor. My neighbor was my pathologist, and his lab that he managed was the lab that identified the cancer that I had.
Wow. Oh my goodness. That so when you finally found out you had cancer, what was your reaction and how did you feel and how did it affect you and your wife?
So I'm sitting at home. This is March 15th, 2011, and I've had the bronchoscopy done, and I'm awaiting a phone call, and I'll never forget the phone rang right at 3:30. I think all of us cancer patients know where we were, what the exact time and what the day was and date that we were told we had cancer. And the phone,
I actually don't.
oh, don't you?
No.
So the phone rang and I picked it up, and it was my pulmonologist, Dr. Bowen. And he said, the first thing he said to me, he says, "I'm sorry, Mr. Brausen, you have lung cancer." And I literally dropped to my knees. I was at home by myself and fell to my knees, and I was muttering, what are the next steps, doc? I was I mean I was in a state of shock, obviously. And so I just muttered some very incoherent questions back to him. And then I called my wife Rosie and I said, "You're not going to believe this." And she thought I was joking. And so we were just stunned, um, to say the very least. And my wife, at first, when I told her, thought I was kidding because I'm a bit of a prankster and jokester. This was no laughing matter.
Absolutely not. Absolutely. And so how did you move forward and what were your plans once you got that diagnosis?
So my wife and I walked around a lake, and we kind of knew this was going to be a fairly involved treatment, um, and cycle. And she said, "You don't have to go through this. There are options. You don't need to do this." And I turned to her. It's one of those conversations you'll never forget. I turned to her and I said, our boys were 13 and 10 at the time. I turned to her and I said, "There is no choice here. This is what I'm going to go through with anything that they're going to use to fight this disease, because our boys are 10 and 13.
Mhm.
They need me. They need us together." And there was no choice in the matter. So we decided that we were gonna press forward with whatever treatment they were gonna attack this with. And so the treatment started as, so now they had to stage me, and they staged me at 3B, lung cancer. And then the big decision was, can we operate on this cancer? So some further surgeries and tests were done, um, ruling out, they're trying to figure out where the cancer was and where it wasn't. And all the indications came back. It was confined to my left lung. And so I was set up with a surgeon, Dr. Matt Graycheck, here, in one of the finest thoracic surgeons in the area. And it was decided that my left lung would be removed. It's called a pneumonectomy. So that was the first step in my treatment, was to take out my left lung, which is where the cancer was localized, we thought. But during surgery, we found out it was escaping. It was found in two lymph nodes behind my left lung, and which was a very unexpected development. And then, so after the surgery was done, um, the margins were positive. They couldn't cut all the cancer out. That's why they gave me such a small chance of survival from this cancer, because normally you like nice, clean, negative margins with surgery. My margins were positive, and there was cancer left over. So what was ordered after that, were 3 months of chemotherapy. There was some biomarker testing done at the time. I didn't qualify for any of that. So they called it the kitchen sink approach. We're going to do surgery, and then we're going to do chemo, and then we're going to do radiation. 3 months of chemo, 7 weeks of radiation. That was 35 treatments. And there was no plan B. There was no second or third lines of treatment. This was it. If this didn't work, there was no other treatments they could give to me.
So can you describe what it was like going through that lung uh
The pneumonectomy.
yes. Yeah, thank you, because I couldn't pronounce that.
Yeah. So I was I really had to wrap my head around that they were going to do this to me. So I went in, I'll never forget this. I went in and they presented me. You meet with a physician's assistant like the day before, and they walk you through what the procedure is going to be. And they had a 3-ring binder kind of explaining the pneumonectomy. And she started explaining what the surgery was all about, and what was the how I would feel coming out and so forth. And I just told her to close the book. I didn't even want to know what I was going to go through. I kind of took the ignorance is bliss approach. And I said, I'll just be here at 5:30 in the morning tomorrow morning, and I'll be ready to go. And the surgery is about 6 hours. And I came out of it, and I came out of it breathing on my own. I had a spinal block, which blocked all of the pain from my waist up. Um, and so I didn't feel anything until they removed that block, and there was a significant amount of pain that I had to deal with after, because that transition from the spinal block to the oral meds was a big drop off in relief. And so the first few weeks at home were extremely painful. But over time I started to heal and started to feel better, and just in preparation for chemo, which was the next step. So it
Oh
was a
my,
lot. I'm not
I
gonna lie, it was a lot.
wow, that's just so mind blowing to me.
Yeah. Yeah, and
So
they go in through your back. They don't take it out your front. So if you look at me from the front, it's like they didn't do anything, but I have a huge scar in the back. It looks like I got bit by a shark in the back.
wow, on your lower back or your
Yeah, well, yeah, it's
head?
kind of mid to lower back. Yeah,
Uh-huh.
yeah.
Wow.
But you know what it is? The human body is an amazing It's an amazing machine. How to how you can recover from something from a surgery that radical is pretty amazing.
Yes. I mean, it's miraculous that
Yes.
we're talking to you right now.
Yeah.
That's so incredible. Absolutely incredible. So you had the surgery and then you went through all this chemo and radiation and everything like that. Uh, how's your life going at that time? And are you working at all? Or are you just not? I don't see how you could work.
No, I left Seagate. My surgery was on April 7th, 2011. I went in before my doctor's appointment on April 6th, and I said to my boss, I said, I'll be back. I need some time off, but I'll be back. And I was out of work. So chemo was very difficult. No way I could have, and everything was cumulative. So you had the surgery first, and then chemo after that became cumulative, and then radiation after that. So everything was kind of piling on each other,
Hmm.
making things just worse and worse and worse. And by the end, I had fatigue. I had such bad. I was only up from like 9 o'clock in the morning until I don't know late afternoon. I was so fatigued from everything I'd gone through. So that all of the treatment timed out right around Halloween of 2011. And so I said to my boss, he said, "So when are you going to come back to work?" I said, "Well, um, can you give me to the end of the year?" And he said, "Okay." So he gave me to the end of the year, and I went back part time, and I had a hard time making it, you know, 4 or 5 hours a day, and I was just doing very minimal things. But over time, I started feeling a little better. I got back in the gym. I'll tell you, I cannot tell you how important that was. I hired a person. We had a personal trainer at our where I worked. Her name was Christine Becker, and she was like a drill sergeant with me. And she got me on the treadmill, and it was so painful and so hard, and got me back lifting weights, and it did miraculous things for me, and it allowed me to get back almost. No, there was a lot lost. I'm not going to lie. There was a lot lost physically in this journey, but I can lead a pretty good life the way I am right now.
So how would you say that being an athlete, how did that influence your cancer journey?
I think it really helped me coming into it, because this journey was a lot. It took a tremendous physical toll. And I think if I was not in such really good shape going into it, I would have had a much more difficult time. It helped me coming in, and it helped me recover. So I think I've always had an athletic mindset, Mark. Um, I always feel like, fitness is one of these things where you're not necessarily going to live longer because you work out, but I think you're going to live better. And I always live by that mantra, and I continue to do that today. And just having that athletic mindset the entire time, I think really, really helped me, not only coming into this, but getting out of it too.
Beautiful. That's beautiful. Can you please share with everyone about the book that your wife
Mm.
wrote? And you are gonna love, absolutely love this title. Go ahead, Gary.
So it's really miraculous how this whole book thing even happened. So we went to a graduation party the summer of 20, gosh, I don't remember, there 2012 or 2013. No, I think it was 2014, I think it was. And it happened to be at the house of a gentleman that produced books. He was a book publisher.
Mm-hmm.
And he comes up to me and he says, "I understand you have a little story to tell." And I said, and my wife Rosie and I were standing there, and I said, "Yeah." So I gave him kind of a thumbnail, um, kind of overview of what happened to me. And he looked at Rosie and he says, "I need you to write that book." And so that was in June. It was a graduation party. So June of 2014. He said, "I want it in 6 months." So she wrote this book in 6 months. And the name of the book is Praying for Healing While Planning a Funeral. And what that title is about is the struggle that my wife Rosie had between what she was hearing, all the doctors saying. We had 3 opinions about the cancer that I had, and they all agreed he's terminal. He's got no more than 2 years, most likely one. He's not going to live through this. Get your affairs in order. Take a family picture. This is the best he's going to look. These are the things we heard. And then hearing from above, he's going to be fine. And we had in this book, there's some pretty incredible stories about some of the kind of very interesting things that happen that are unexplainable. And you just have to read the book to hear about them, because there's some things that happen, clear signs that I was going to be okay. Because I had a hard time with it, because I'm an engineer. Things are visual to me. I needed visual confirmation that I was going to be okay, and I got it during this journey. So she writes this, so it was the struggle between what she heard from above, he's going to be okay, versus what the doctors were saying, that he's terminal. and he's only got a year to live, most likely.
Wow, I can't wait to read it. Absolutely. Uh, I just love this conversation. I absolutely love it. What would you what would you like to leave as a final thought for our audience?
I learn, Mark, so much in this journey. I was a very flawed person going into this journey, and I suffered from idolatry. I put things I made things that were not important more important than they should be, and the things that were most important at the expense of the things that are most important. And what cancer did is it strips away everything that doesn't matter. And the things that don't matter are your possessions and your job, and all of these earthly things really don't have any meaning when you're fighting for your life. And what are you left with? I was left with my faith, I was left with my family, and I was left with my friends. That's it. And that's all that matters. And I continue to live that way today. I wake up every day and I look around my house and I see all these things. You could take it all away today. It would not matter one iota as long as I have my faith, my family, and my friends. That's it.
Wow. I I ask everybody that, and I think that's one of the best responses as a final thought that I've ever
Oh,
gotten. So thank you
oh,
so much for sharing that. And that is my exact sentiment as well. We're definitely on the same page for. So thank you for sharing that. Thank you for sharing your journey with us. And I know you're going to continue to do great things with your work with the lung cancer patients. And I look forward to, keeping in touch
for
and
sure.
seeing the growth in both of our worlds. I think that'll be absolutely terrific. And I'd like to thank you so much, Gary. Thank you. It was beautiful, really beautiful.
Thank you, Mark. It was an honor to be here.
Oh, thank you. And I'd like to thank everyone for joining us here at To Be Your Own Hero. Uh, Again, please subscribe, like, and make a comment in the comment section of the video and make the most out of every single day. And I'd like to leave everybody with a couple of quotes from Dr. Norman Vincent Peale. And the first one is, never bog down in a defeat psychology. Always in the midst of defeat, keep looking for victory. And the second one is, and I love this one, to keep the magic of enthusiasm working for you, have an eye for the charm and romance of living and practicing aliveness. Kind of a rough play on words, but I love that quote nonetheless. And life, as Gary and I know, is so precious. It's such a gift, and both of us are thankful every day for opening up our eyes and having the absolute blessing of experiencing another day. And I hope you look at it the same way. And this world that we live in is so divisive, and there's so many negative things going on in it. And the only way that it's going to change is if we, the people, make it better. And so you never know what another person is going through, what their day is like. So smile, help somebody out, carry someone's grocery bags. Excuse me. But it's going to take an effort from all of us to make our world a better place. And that's what it's all about. So make the most out of every day. every hour, every minute, and every breath. And thank you once again for joining us here at To Be Your Own Hero. And we will see you next week. Take care and be blessed.